23.2% of U.S. adults are currently meeting physical activity recommendations. 23.2%. This statistic is not surprising. An obesity epidemic has plagued America for decades, and with it, a number of chronic health issues such as diabetes, cardiovascular disease, and certain types of cancer. It is common knowledge that physical activity and obesity have a strong negative correlation, meaning obesity rates and the associated chronic health conditions decrease with increased physical activity. However, the knowledge that over 75% of the country, almost 250 million people, does not receive enough physical activity is alarming. This raises the question, what is enough physical activity? According to the Physical Activity Guidelines for Americans, published by the U.S. Department of Health and Human Services, adults should complete at least 150 minutes of moderate to vigorous intensity physical activity each week, in addition to strength training of all major muscle groups at least twice weekly. Children, on the other hand, should participate in an hour of physical activity each day. How many of you are currently meeting the physical activity guidelines? Probably the majority. As students, we walk to class daily, have unlimited access to university fitness facilities, and have ample access to trails and recreation spaces in and around State College. But consider this. At this point in your life, you are statistically the most active you will ever be. This is because the environment in which you live, your built environment, has been catered to allow you to achieve this goal. In order to enable the majority of U.S. citizens to meet their physical activity guidelines, local governments must alter their policies regarding the built environment to provide their community members with the opportunity to exercise. The built environment, and lack thereof, is one of the main inhibitors of physical activity for Americans, regardless of the environment in which they live. Rural Americans account for some of the highest rates of obesity and physical inactivity, and according to the most recent U.S. Census, approximately 20% of the population falls into this demographic. Those living in rural areas often live miles away from their closest neighbors, over an hour from the nearest grocery store, and several hours from the nearest metropolitan center. In an area this isolated, there are very few public recreation spaces, such as parks, sidewalks, and community centers, all aspects of the built environment that play a pivotal role in increasing physical activity intake. Similar to its rural counterpart, the urban built environment is also plagued by a number of factors inhibiting physical activity. Urban areas are home to approximately 80% of the American population, and logically have an increased prevalence of recreational spaces. However, increased population and population density also result in higher crime rates. According to the National Center for Victims of crime rates in metropolitan counties and those just outside are double what they are in rural areas. The safety of the urban built environment is one of the largest barriers to physical activity. In a study of African Americans living in urban areas, one participant confirmed that safety was one of her primary concerns. The woman stated, "I have a park right across from my house, and I wouldn't go there if you paid me." Indoor facilities also posed a challenge for many of those living in urban areas. The areas where community centers are located, when they do exist, are often unsafe, presiding in areas saturated with extreme poverty, drug use, and crime. In areas where safety is not a concern, community centers and recreational spaces often lack valuable resources that would enable children and their parents to meet the physical activity recommendations. In all communities, socioeconomic and sociocultural factors are at play in determining the built environment and physical activity intake. The CDC has shown that income and educational achievement are positively correlated with regular physical activity. There are a number of explanations for this trend. Those with lower incomes generally have to spend more time working in order to provide for their families, and are more likely to live in areas that lack resources necessary for physical activity. On the other hand, higher levels of education are strongly correlated with higher income, so those who are more educated likely make more money, work fewer hours, and live in areas that are more conducive to physical activity. Culture also plays an important role in physical activity participation. For example, familism, a social structure in which the needs of the family take precedence over the needs of an individual, is one of the key components of Latino culture. This can result in tasks like childcare and household chores taking precedence over individual physical activity. When implementing policy change, it is essential to account for communities' socio-demographics and values in order to maximize intervention effectiveness. It is apparent that physical inactivity is a problem in the United States, but there are solutions to alleviate some of the strain. I propose creating community wellness centers in both urban and rural environments, implementing sidewalks and/or bike trails throughout communities, and providing security services to enhance safety of recreational spaces, primarily in urban areas. Community wellness centers have proved to be effective in a number of environments. In addition to providing safe spaces for exercise, childcare services, and a social environment, a number of community-specific interventions occur in these facilities as well. An intervention was conducted with a population of Hispanic elders. Participants were taught dances specific to Latino culture as a form of physical activity, and the intervention was provided in both English and Spanish to increase participation in the target audience. The intervention was wildly successful, and through the use of community centers, it is possible to implement similar interventions specific to each community. Funding and resources often pose a challenge for community centers. However, there are a number of federal grants available to help support these initiatives. An additional way to combat this problem is by pairing with local universities. University students and researchers would be able to implement various interventions at community wellness centers, and when applicable, could provide other services such as mobile health clinics and counseling at the wellness centers. In addition to helping the community, university students would be garnering valuable first-hand experience in disciplines of their interest. Increasing the prevalence of sidewalks and bike trails is another way to increase community physical activity. A study by the University of Michigan showed that people are less likely to exercise if sidewalks are not present or are of poor quality. It is necessary to ensure that sidewalks are both present and well maintained in our communities. In rural areas where sidewalks are not practical, bike paths can be implemented to allow community members to easily traverse far distance in an active manner. Communities such as Boulder, Colorado, and Portland, Oregon can be used as examples for this intervention, as both areas have excelled in creating a built environment fit for an active population. The final proposed change addresses the concern for safety. In order to increase safety in currently existing recreational areas, it is necessary to have either a security guard, community watch program, or police officers making regular rounds throughout the park. In the study of recent African American women mentioned previously, when a security guard was posted, even for just a few hours, use of the local park increased exponentially. Community members felt safe enough to leave their houses and take their children, the most vulnerable members of the population, to the park to be active. Despite its cost, this intervention can be viewed as a long-term investment. Although change will not be immediate, enabling community members to participate in physical activity will eventually help lower rates of obesity and associated diseases, decreasing money spent on healthcare overall. Creating an environment where people feel safe to exercise is essential for increasing physical activity participation. In order to implement these changes, we need leaders across the United States to devote themselves to the betterment of their own communities. Every community is different. They have different populations and different needs. The necessary changes for an urban environment will not equate to those in a remote part of the country, but all of these new policies have a common variable. The changes implemented are necessary to increase physical activity and in turn decrease rates of obesity, cardiovascular disease, diabetes, cancer, and other associated diseases. Community health is a shared responsibility. A community is only as healthy as its least healthy members, and a country is only as healthy as its least healthy communities. It is vital to implement these policy changes at the local level to increase physical activity intake in an effective manner for each specific community, and ultimately improve total population health. Thank you.